Well, my presentation will be on Emergency Medical Treatment and Active Labor Act. Terminology used will be Emtala, which is Emergency Medical Active Labor Act. 2, the Dedicated Emergency Department, which is the DED. Emergency medical conditions, medical screening exams, patient dumping, and triage. The beginning of Emtala began in the 1980s when there was increased patient dumping. Emtala and COBRA was created in 1986. Medicare provider hospitals must provide medical screening and stabilizing treatment to any patient who seeks care in their emergency department. This applies to all participating hospitals. Emtala. The core purpose of Emtala is to get patients into the system that might otherwise go untreated. This is not intended to guarantee proper diagnosis or to provide a federal remedy for misdiagnosis or medical negligence. Unbridled Emtala could unduly burden hospitals, result in decreasing available emergency care rather than intended increase. The intent was fair treatment for all. Emtala. The emergency department requirements for Emtala are signage, on-call physicians, and a central log. Also, record retention for a minimum of 5 years. It is the law. If you have a medical emergency or are in labor, you have the right to receive within the capabilities of this hospital staff and facilities. 1, an appropriate medical screening exam. 2, necessary stabilizing treatment, including treatment for an unborn child. An appropriate transfer to another facility, even if you can't pay or do not have insurance or you're not entitled to Medicare or Medicaid. Most facilities participate in the Medicare program. Emtala. The Act imposed 3 primary provisions requirements on hospital emergency departments. 1 is appropriate medical screening exam, which is an MSC, which is provided by a qualified medical person. Cannot be delayed to inquire about methods of payment of insurability. Any request for emergency medical treatment triggers Emtala obligations. If no medical condition exists, Emtala obligation ends. And 2 is to provide stabilizing treatment if individual has an emergent medical condition. Address or resolve the condition, treat, admit, or stable transfer. Stabilized, no material deterioration, likely delivery of child with placenta, or if not stabilized, provide appropriate transfer. A dedicated emergency department is licensed as an emergency department, presents itself to the public as providing emergency care on an urgent basis without requiring prior appointments. Provided at least 1/3 of its outpatient service for emergency care on an urgent basis without an appointment. Also maintains a list of all on-call physicians. Another emergency medical condition, a medical condition manifesting itself by acute symptoms of sufficient severity includes severe pain, such as the absence of immediate medical attention that could reasonably be expected to result in placing the health of the individual, or with respect to a pregnant woman, the health of the woman or her unborn child in serious jeopardy, or serious impairment of bodily functions, or serious dysfunction of any bodily organ, or with respect to a pregnant woman who is having contractions. That there is inadequate time to effect a safe transfer to another hospital before delivery, or that the transfer may pose a threat to the health of the safety of the woman or her unborn child. Determination is ultimately a medical rather than a legal one and is subject to critical retrospective review in the event of litigation. Medical screening examination is a process required to reach, with reasonable clinical confidence, the point at which it can be determined whether a medical emergency does or does not exist. It must be the same MSC that could be performed regardless of the ability to pay, the diagnosis, the race, color, national origin, disability, age, and do not delay the MSC awaiting parental consent. MSC must be detailed enough to determine if an emergency medical condition exists by obtaining an appropriate medical history, perform an appropriate physical examination, perform appropriate diagnostic testing, consult with pertinent on-call physicians, reassess the patient prior to discharge or transfer, ongoing process until the patient is stabilized, discharge or transfer is complete. Patient dumping is the practice of denying care to patients due to their inability to pay. Triage, a process that determines the order in which patients will be seen. Triage is not a medical screening examination. Stabilizing treatment of emergency conditions within the capability of the staff and facilities. Emergency medical conditions. No material deterioration of the patient's condition is likely to result from the transfer or is likely to occur during the transfer. Active labor. The infant and the placenta have been delivered. And transfers. When the patient requests one, when she becomes stable or the condition resolves. In layman's language, a patient may be freely transferred either before the emergency condition arises or after it has been resolved, and they may only be transferred under a defined set of circumstances while the condition persists. The appropriate transfer. Per patient request, informed consent including risk and benefits. Medical benefits outweigh risk. Physician certification or QMP with physician consultation. An appropriate transfer before stabilization, which is legal under Emtala. Treat to minimize risk within the facility's capacity and capability. Receiving facility has space and qualified personnel agrees to accept transfer and treat. Health records are sent with patient or soon after, and qualified personnel and transportation equipment. Emtala conclusion. A hospital's Emtala obligation ends when a physician or qualified medical personnel has made a decision that no emergency medical condition exists even though the underlying medical condition may persist. That an emergency medical condition exists, an individual is appropriately transferred to another facility, or that an emergency condition exists, an individual is admitted to the hospital for further stabilizing treatment. In summary, patients who present to the emergency department are all triaged by nursing or a qualified medical provider to determine if an emergency medical condition exists during a medical screening exam and stabilize or transfer if appropriate. All patients who present for emergency services and triaged are logged into the emergency log book. And I also attached a test.